All right. So, you sent us something pretty disturbing out of Massachusetts.
Oh, yeah.
Yeah, this is about the Newton-Wellesley Hospital
Okay.
on their 5th floor.
Mm-hmm.
It's the maternal care ward.
Gotcha.
At least 10 nurses there have been diagnosed with brain tumors
Wow.
in just recent years.
So in a short time span.
Yeah, and it's a mix, too.
What do you mean?
Some are malignant,
Yeah.
so cancerous,
Right.
but others are benign.
Okay, so non-cancerous,
Yeah, exactly.
but still brain tumors.
Yeah, and so it's like when you hear about something like this,
Right.
so many in one place,
Yeah.
you can't help but think,
What is going on?
exactly.
That's alarming for sure.
What's going on here? Is there something in the environment?
Yeah, I mean, that's what you immediately think of, right?
Totally.
What do they all have in common?
Well, they all work on the same floor
Right.
at the same hospital.
And what makes this stand out even more
Yeah.
is that it's all on one unit.
Yeah,
So really makes you wonder about their workplace environment.
absolutely. And it seems like the staff at Newton-Wellesley,
Mm-hmm.
they felt the same way.
Makes sense.
They were concerned enough to start an investigation
Oh, wow.
back in December 2024.
Last year.
Yeah. And I mean, you can understand why.
Oh, absolutely.
It's scary.
Yeah, when you see your colleagues
Yeah.
facing these health problems,
Uh-huh.
you want answers.
Totally. It's just natural to want to figure out what's happening.
Of course.
Yeah. So what do they do?
Well, they really went all out in the response.
Oh, yeah.
Yeah, they actually collaborated with the Massachusetts Department of Occupational Health and Safety.
Wow.
They followed CDC guidelines.
You know, the ones for investigating environmental links.
Right, exactly. Looking at how people might get exposed to different things in their environment
Yeah.
and what the effects could be. And then they even brought in outside help.
Really?
Yeah, environmental consultants.
Wow, that's
Sounds like they were taking it seriously.
it really does. It sounds like they were really trying to figure out
Yeah.
what, if any, connections there were.
Right.
They were looking at the air quality,
Mm-hmm.
water safety radiation levels.
Pretty thorough.
Yeah. So did they find anything?
Well, their investigation said no environmental risks were connected to the brain tumors.
So pretty definitive.
It sounds that way, right?
Yeah.
Like a clear answer.
Case closed.
But here's where it gets interesting.
Okay.
It's important to consider everyone's perspective.
Okay.
Because even though that's what the investigation found,
Right.
the nurses are still afraid.
Yeah.
And they're frustrated.
Yeah. Why is that?
Well, some of them are still worried about their safety at work.
Even after the investigation.
Yeah, and it's understandable.
I mean, if I was working there
Yeah.
and I saw so many of my coworkers getting diagnosed with brain tumors,
Right.
I'd probably still be freaked out.
And it's not just fear, you know?
Yeah.
3 of them have had surgery.
For their brain tumors.
Yeah.
Wow.
So it's really having an impact on their lives.
Right. So saying that there are no environmental risks
Mm-hmm.
doesn't necessarily mean that everything at work is okay.
Exactly. It could just mean that what they tested
Yeah.
was within acceptable limits.
Right. Like maybe there's something else going on.
Or maybe what they used to test just wasn't sensitive enough
Yeah.
to pick up on something more subtle.
Interesting.
Something that could still be a factor.
Okay, so the hospital said they didn't find anything,
Yeah.
but the nurses are still worried.
Yeah.
Have they done anything to address that?
Well, yeah, they have tried to reassure everyone,
Okay.
both the staff and the patients.
Mhm.
They shared the results of the investigation with the Massachusetts Nurses Association.
Okay.
And they've held these forums to talk to the staff.
So they are at least trying to communicate?
They are engaging
Yeah.
and sharing information, which is good.
Yeah.
But here's the thing.
Okay.
It's still not resolved.
Oh.
Yeah, the nurses are still pushing for more investigations.
They want to be sure that their workplace is safe.
Exactly.
I mean, that makes sense, right?
Absolutely.
They deserve to feel safe at work.
And it raises the question, like,
Yeah.
how much certainty do we need in situations like this? And how do we even decide when enough investigating has been done?
That's a really good point because, you know,
Yeah.
it sounds like the hospital did a pretty thorough job,
Yeah.
but it's still not enough for the nurses.
Right. And how do you balance those two things?
Exactly.
It's tough.
So what's the main takeaway for you with this story?
Well, we've got this really worrying number of nurses with brain tumors,
Yeah.
all in the same unit,
Mm-hmm.
which immediately makes you suspicious.
Yeah.
But then the hospital says there's no environmental cause.
Right.
So it really shows you the difference between the official findings
Yeah.
and how the people who are actually affected feel.
Yeah, the lived experiences of the people who were right there.
Exactly. And the anxiety they're going through.
Yeah, and the sources you sent, They give us both sides of this issue.
Yeah, both the formal investigation and the very real concerns of the staff.
And it leaves us with something big to think about.
It really does.
This is where it gets really interesting.
Okay.
Given all this information, how hard is it to actually figure out what causes health problems like these?
It's a big challenge.
Especially when you have all these different factors.
And they could be really subtle.
Yeah, and they could be happening over time.
It's like a huge puzzle.
Absolutely.
Yeah.
It's a really complex situation.
Definitely.
Lots to think about.
For sure.
Thanks for sharing this with us.
No problem. Glad we could unpack it.
Yeah, me too.
Thanks for listening.